The blood pressure myth for seniors, it's not 120/80. If you're over 65 and at some point a doctor or a chart or a leaflet told you that your blood pressure absolutely has to be 120/80, I need you to keep watching. Because for you, at your age, chasing that exact number can quietly do you real harm. And I know exactly how that sounds. You've had 120/80 drilled into you your entire life as the magic number. The gold standard, the thing to aim for, so when an ER doctor tells you it might be the wrong target for you specifically, your guard goes up. And honestly, it should. So stay with me, because I'm not going to ask you to take my word for anything. I'm going to walk you through what the actual research says and why a single number, all on its own, can lie to you. Here's the thing that makes this so important. High blood pressure is the classic silent killer. It damages your arteries, your brain, your kidneys, and your heart for years without a single symptom. That part is true, and I never want you to forget it. But for seniors, there's a second silent danger almost nobody talks about, and that's overtreatment. Pushing the number too low, too aggressively, until you're dizzy, unsteady, and one bad step away from a fall that changes everything. The myth of the single perfect number can hurt you from both directions. And by the end of this video, you'll know how to find the number that's actually right for you. Hi, I'm Dr. James Whitfield. I'm an emergency medicine physician. I've spent just over a decade in the ER and treated more than 40,000 patients. And I'll tell you, I have seen both sides of this. I've seen the strokes from blood pressure that nobody managed. And I've seen older adults wheeled in after a fall, a broken hip, a bleed on the brain, because their pressure was pushed so low they fainted standing up. My whole mission with this channel is to keep you out of my emergency department, and that means getting this exactly right. So here's what we're going to cover. First, I'll show you what blood pressure actually is, broken down into 3 simple forces, because once you see it, the whole myth falls apart. Then I'll show you why seniors are genuinely different, why your arteries change with age in a way that makes 120/80 the wrong picture. We'll look at what the big studies actually found, including why even the experts don't fully agree, and that's going to tell you something important. And then I'll give you a practical, step-by-step framework to find your real target, measure it correctly at home, and have a much smarter conversation with your own doctor. Before we dive in, one small ask. If these videos help you, please consider subscribing. I promise to keep making the most honest, useful videos I possibly can, and if you reach the end of this one and you haven't learned something new, feel free to unsubscribe. No hard feelings at all. The thing is, only about a quarter of the people who watch actually subscribe. And that little button is what helps this channel reach more people who really need to hear this. So please, 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 if you can, hit subscribe. It genuinely helps. Okay, let's start with what blood pressure even is, because it's beautifully simple when you break it down. When the cuff gives you 2 numbers, like 120/80, those 2 numbers are telling you 2 different moments. The top number, the systolic, is the pressure in your arteries at the instant your heart squeezes and pushes blood out. The bottom number, the diastolic, is the pressure in between beats, when your heart relaxes and refills. Squeeze, then rest. Top number, then bottom number, that's all it is. And what controls those numbers? Here's where it gets clean. Your blood pressure comes down to 3 forces, and 3 forces only. Force number 1 is the pump, your heart, how hard and how fast it's pushing. Force number 2 is the pipes, your arteries, and specifically how tight or how stiff they are. And force number 3 is the fluid, the actual volume of blood and water in the system, the pump, the pipes, and the fluid. Turn any one of those up, and the pressure goes up. Picture a garden hose, squeeze the pump harder, narrow the hose, or add more water, and the pressure climbs. It really is that simple. Now here's where it gets really interesting, and this is the part that changes everything for an older adult. As we age, the pipes change. When you're young, your arteries are soft and springy, like a brand new garden hose. They flex with every heartbeat and soak up the shock. But over the decades, the walls of those arteries gradually stiffen and harden. They lose their give. Now picture that same hose left out in the sun for 20 years, gone stiff and rigid. When the pump pushes against a stiff pipe, the top number, the systolic, spikes much higher because the artery can't flex to absorb it. And at the same time, the bottom number, the diastolic, often drifts down or stays low. So what we see in older adults all the time is not the textbook 120/80. It's something like 160/70, a high top number and a lowish bottom number with a big gap between them. We even have a name for it: isolated systolic hypertension, and it's the most common pattern of high blood pressure in seniors by far. What becomes obvious here is that the simple 120/80 model was really built around younger arteries. Your body is playing a different game now, and this is exactly where the trap springs shut. Let me be really honest here, because this is the part that lands people in my ER. Say an older adult has that 160/70. A well-meaning effort to force that top number all the way down to 120 might mean piling on more and more medication. But remember, the bottom number is already on the low side. Push the whole system down hard enough, and you can crash the pressure, especially when the person stands up. We call that orthostatic drop. The blood literally can't get up to the brain fast enough, and you get that horrible swimming, lightheaded, gray-out feeling when you rise from a chair or get out of bed at night. And in an 80-year-old, that's not a minor annoyance. That's a fall. That's a broken hip. That's a head injury. The chart might say the number looks perfect, while the person is on the bathroom floor at 3 in the morning. That's the silent harm of over-treatment, and almost nobody warns you about it. So let me name the true villain, because it is not a number at all. The villain is the one-size-fits-all myth itself. On one side, it tells people to ignore genuinely dangerous pressure. On the other, it pushes frail seniors too low and knocks them off their feet. The number was never the enemy. Treating it as a single magic target for every human being on Earth, that's the enemy. Now, what does the actual science say? Because I promised you evidence, not opinion. There was a major trial called SPRINT, the Systolic Blood Pressure Intervention Trial, published in one of the top medical journals with over 9,000 people. And it found something powerful. In adults at high cardiovascular risk, aiming for a lower systolic target, down around 120, reduced heart attacks, heart failure, and death compared to the looser target of 140. The reduction in deaths was around a quarter lower. And here's the striking part: this benefit held up even in the group over 75. So lower can absolutely be better, that's real. But, and this is a big but, the same trial showed the lower target group had more side effects. More fainting, more dizziness, more episodes of the pressure dropping too far, and more strain on the kidneys. And here's a detail almost no one mentions. The way they measured blood pressure in that study, with a careful automated machine and the patient sitting quietly alone, tends to read several points lower than the rushed reading you get in a busy office. So that study's 120 is not the same as the 120 on your cuff at the pharmacy. The number, once again, depends entirely on how and where you measure it. And then there's the part that should really make you pause. The major guideline groups genuinely don't all agree on the senior target. Some lowered the bar to 130/80 for most adults. Others argued for being more relaxed in older patients, somewhere closer to 140 or even 150 on top, especially in those who are frail. When the world's top experts looking at the same evidence land in different places, that tells you something honest. There is no single right answer that fits everyone. There's only the right answer for you. So here's the flip, the good news, the thing I really want you to take away. The fix isn't a magic number. The fix is finding your number with your doctor and then measuring it properly. Let me give you the step-by-step plan. Step 1, find out your actual target and ask the question directly. At your next visit, ask your doctor this exact thing. What is my personal blood pressure target? And why is it that number for me? A good answer will factor in your age, how steady you are on your feet, your other conditions, and how you tolerate your medications. If you're generally fit and active, your target may sit lower, often around 130 on top. If you're older and frailer or prone to dizziness, a slightly higher, gentler target may be far safer. There is no shame in the gentler number. For you, it might be the right one. Step 2. Measure it correctly at home, because almost everyone does this wrong. Get a good upper arm cuff, not a wrist one. Sit quietly for 5 minutes first. Back supported, feet flat on the floor, legs uncrossed, arm resting on a table at about heart level. No coffee, no cigarettes, no exercise in the 30 minutes before. Then take 2 or 3 readings a minute apart and write down the average. Do it in the morning and again in the evening. A single reading is a snapshot. What we actually care about is the movie, the trend over days and weeks. Step 3. Check it standing up. This one is just for you seniors, and it's so important. After you've measured it sitting, stand up, wait about a minute, and measure again. If the top number drops a lot when you stand, or you feel dizzy, write that down and tell your doctor. That's the early warning sign of overtreatment, and catching it can save you from a fall. Step 4. Use the lifestyle levers because they genuinely move the needle. Bringing down the salt in your diet, eating more vegetables, fruit, and potassium-rich foods, and moving your body most days can each lower your pressure on their own. Just be careful with potassium if you have kidney problems or take certain pills, so check that with your doctor too. Keeping alcohol modest helps, and getting your sleep looked at matters more than people think because untreated sleep apnea quietly drives blood pressure up night after night. Step 5, and please hear me on this one. Never, ever change or stop your blood pressure medication on your own based on a video, including this one. If something here made you think your treatment might not fit you, that is fantastic. Take it to your doctor as a conversation. Stopping suddenly can be genuinely dangerous. The goal is to make you a smarter partner in your own care, not to have you adjusting pills in the kitchen. And finally, know the true red flags. If you ever get a very high reading along with a pounding headache, chest pain, trouble breathing, sudden weakness, confusion, or changes in your vision, that is not a wait-and-see situation. That can be an emergency. Call for help right away. So, let's pull the camera back for a second. The point of managing your blood pressure was never to win a prize for the prettiest number on a chart. The point is for you to stay sharp, stay steady on your feet, and stay independent, walking yourself out the front door and back into your own life, well into your 80s and beyond. A number that looks perfect on paper but leaves you dizzy and falling has missed the entire point. The healthcare system is wonderful in a crisis, but it doesn't always slow down to find the number that fits your one specific life. That part, the questions, the home readings, the honest conversation, that part is yours. And when you do it, you take back control of the silent process that quietly shapes the rest of your years. If this helped clear things up, do me a favor and hit subscribe, give it a like, and send it to an older parent, friend, or neighbor who needs to hear it. It really does help this channel reach more people. Take good care of yourself, and I'll see you in the next one.